7 medications that can cause dementia. Memory loss, medically known as dementia, currently affects about 50 million people worldwide. It's a chronic and irreversible disease that leads to poor quality of life, high dependency rates, increased mortality, and high costs for healthcare services in all countries. While age is the primary risk factor for dementia, other factors are contributing to the onset of this disease at earlier ages. It's estimated that by 2050, over 130 million people globally will suffer from dementia. There's a large underreporting of cases because the symptoms of memory loss often appear slowly and progressively in many cases. But did you know there are other risk factors besides age for dementia? Did you know that some medications can cause dementia, even in younger patients? Stay tuned to this video, and you'll learn much more about the medications involved in the early onset of dementia. Dementia. Anticholinergics increase your risk of dementia. Anticholinergic medications are named as such because they block the action of a chemical called acetylcholine. This is a neurotransmitter that functions to carry information between neurons and from neurons to other tissues. Because its action is mainly at the level of the central nervous system, anticholinergic medications have effects on memory, emotions, bodily mobility, and even learning. It has been shown that patients suffering from some types of dementia, including Alzheimer's, have lower levels of acetylcholine than healthy individuals. However, it hasn't been effectively demonstrated that this decrease in acetylcholine is responsible for the entire clinical picture of dementia. It's only part of a very complex neurological problem. There are many anticholinergic medications available today, including antihistamines or anti-allergy medications, some medications used for irritable bowel syndrome and overactive bladder, among others. Among the effects they mainly exert on smooth muscle, both in the urinary tract and in the digestive tract, is muscle relaxation and pain reduction in the case of intestinal colic, or even reducing the frequency of urination in the case of overactive bladder. However, they have numerous effects on almost the entire body. Among the antiallergics are diphenhydramine, chlorpheniramine, and doxylamine. Medications for irritable bowel syndrome include Yosim, dicyclamine, and trimibutine. Medications for overactive bladder like darafenacin, oxybutynin, and tolterodine. Research conducted by scientists at the University of Nottingham in the UK has been able to demonstrate the relationship between anticholinergic medications and the risk of dementia. This study gathered information from around 300,000 people in the UK between 2004 and 2016, and it was determined that anticholinergic medications increase the risk of dementia independently of any other additional factor. There is an almost 50% increase in the risk of dementia with anticholinergics, a higher relationship than with any other medication. The study concluded that people over 55 who had taken anticholinergics daily for at least 3 years increased their risk of developing dementia by 50% compared to those who had not used this type of medication. The study took into account the influence of other risk factors, so the effect of anticholinergics on the risk of dementia was fully demonstrated. It was not possible to determine if any particular type of anticholinergic was more dangerous for memory loss. Similarly, the risk is increased equally in both sexes. Other 6 medications that can cause dementia. Medication. Number 1. Gastric protectors. Several scientific studies have been published that have been able to establish an association between the risk of dementia and the intake of proton pump inhibitors, regularly known as gastric protectors. These medications include omeprazole, lansoprazole, pantoprazole, esomeprazole, rabeprazole, and dexlansoprazole. It has been shown that proton pump inhibitors can contribute to the deposition of proteins called beta amyloid in the brain. This beta amyloid protein is the main one implicated in the development of Alzheimer's in humans. Additionally, proton pump inhibitors decrease the absorption of vitamin B12 at the intestinal level, whose deficiency is also related to an increased risk of dementia. Medication. Number 2. Analgesics. There are numerous analgesic medications on the market with varying mechanisms of action and potency. Surprisingly, it has been shown that some types of pain medications may be associated with an increased risk of dementia. In general, opioid analgesics have significant effects at the level of the central nervous system, which can induce dependence, tolerance, or the need for increasingly higher doses, effects on sleep, and even mood and emotions. But recently, it has been seen that prolonged use of opioid medications can also lead to dementia in the long term. An attempt has also been made to establish the same relationship with non-steroidal anti-inflammatory drugs that are more frequently used, such as diclofenac or ibuprofen. However, this relationship with non-steroidal anti-inflammatory drugs has not been proven. It has also been proposed that the presence of chronic pain can affect the brain and predispose it to memory disorders. So there may be a combined effect of chronic pain plus the use of analgesics with effects at the level of the central nervous system that increase the risk of memory loss. These medications include morphine, hydrocodone, hydromorphone, and fentanyl. Medication number 3, benzodiazepines. Benzodiazepines such as diazepam, bromazepam, clonazepam, and alprazolam, among others, are medications that are increasingly used worldwide every day. However, it has been shown that their prolonged use can increase the risk of memory loss, especially in older people. Benzodiazepines are commonly used for the management of insomnia, anxiety, and depression, but they can generate other problems such as drowsiness, increased falls and hip fractures, cognitive disorders, dependence, alteration in respiratory function, and other side effects. A study conducted at the University of Taiwan showed that there is a 1.5 times higher risk of dementia with the intake of these medications for more than 365 days or 2 years frequently, compared to people who do not take benzodiazepines. Medication. Number 4. Anticonvulsants. There is a group of medications that have anticonvulsant effects, which are used to prevent epileptic seizures and which also have use for mood disorders, bipolar disorder, and chronic neuropathic pain. Among them, we have carbamazepine, gabapentin, lamotrigine, levetiracetam, oxcarbazepine, pregabalin, rufinamide, topiramate, valproic acid, phenobarbital, primidone, and zonisamide. Anticonvulsants are estimated to alter the proportion at the cerebral and neuronal level of some neurotransmitters, including acetylcholine, norepinephrine, and serotonin, which can significantly affect certain areas of the brain and, with prolonged use, cause alterations in memory and predispose to dementia. This alteration in nerve impulse signaling in critical areas of the brain is related to memory loss. Similarly, it has been questioned whether anti-epileptic drugs alone are a major risk factor for dementia, as it has been proposed that epilepsy itself can cause damage at the neuronal level and predispose to memory problems, to which the effect of anti-epileptic medications could be added. Medication number 5, tricyclic antidepressants. Tricyclic antidepressants were the first antidepressant medications developed pharmacologically. They have an effect that decreases the amount of acetylcholine available in certain regions of the brain, which helps decrease pressure, but in other areas of the brain, they could have a negative effect in the medium or long term on the risk of dementia and memory loss. This type of antidepressant is not only used for depression, but also for obsessive-compulsive disorder, some types of anxiety disorders, and even for peripheral neuropathies. Most of the time, these types of medications are used for a long time, but currently, there are new alternatives that are used quite successfully with fewer side effects. However, there is still a group of patients who benefit from the prolonged use of tricyclic antidepressants, but they must be careful about side effects, particularly memory loss. Tricyclic antidepressants include amitriptyline, clomipramine, desipramine, doxepin, imipramine, nortriptyline, protriptyline, and trimipramine. Medication number 6, corticosteroids. Corticosteroids are medications that have been used for decades for their anti-inflammatory effect. However, chronic use of steroids has been associated with a huge number of side effects at the cardiovascular, metabolic, and hormonal levels, which has limited their use and has been reduced only to certain chronic pathologies for which there is no alternative for their treatment. On the other hand, corticosteroids that generate these effects are those that are used orally or intravenously chronically. Many inflammatory problems today can be treated with the topical use of corticosteroids, either used in creams for chronic inflammatory problems in the skin or inhaled, as is the case with asthma and chronic inflammatory bronchial diseases. Today, due to their numerous side effects, oral corticosteroids are administered for a limited time and avoid their prolonged use at high doses. They are particularly useful for improving symptoms in some autoimmune arthritis, such as those associated with lupus, rheumatoid arthritis, scleroderma, and polymyositis, among others. However, among the long-term side effects of the use of oral corticosteroids is memory loss, and this is due to alterations in the level of neurotransmitters that are generated in the brain, which in turn are associated with the hormonal changes caused by these medications. With the intake of these corticosteroids, it is known that there is a change in the availability of serotonin, gamma-aminobutyric acid, and norepinephrine in certain areas of the brain that may be involved in memory loss. The use of oral corticosteroids is associated with depression, mood swings, and episodes of psychosis, among other effects at the level of the central nervous system. Among the most commonly used corticosteroids are cortisone, hydrocortisone, and prednisone. How to prevent dementia. Certain risk factors increase the availability of suffering from some types of dementia. Among these risk factors are age, hereditary factors, high blood pressure, excess blood sugar or diabetes, obesity, smoking, hearing loss, untreated depression, excessive alcohol consumption, physical inactivity, and social isolation. In this same sense, research has been able to demonstrate that by modifying risk factors, 4 out of 10 cases of dementia can be prevented. But what are the changes we can make to reduce our risk of dementia? Let's see. Healthy diet. It has been established that a diet low in saturated fats, with low salt content and high fiber content, decreases the risk of dementia, in addition to controlling other associated problems such as being overweight, less risk of diabetes, hypertension, and high cholesterol, which can contribute to cardiovascular disease and accelerate the risk of memory loss and dementia. Weight loss. Overweight and obesity are also closely related to cardiovascular diseases that can affect the brain, such as hypertension, increased cholesterol and triglycerides, and diabetes mellitus. Together can increase the risk of dementia. However, some studies have been able to demonstrate that obesity and overweight, due to the hormonal changes that are generated, can independently increase the risk of dementia in the long term. For all these reasons, weight control is an important strategy to avoid future memory disorders, especially in individuals with a significant family history. Regular exercise. A sedentary lifestyle has also been linked to an increase in the risk of dementia. This is because a sedentary lifestyle is linked to cardiovascular diseases, diabetes, hypertension, and dyslipidemia. But a sedentary lifestyle also contributes to better blood flow to the brain and chronically increases the risk of dementia. Some studies have been able to demonstrate that physical activity can improve memory problems in patients who already have have dementia, and even better, prevent or delay memory disorders in individuals at high risk and in the general population. Reduce alcohol. Excessive alcohol consumption is linked to all causes of a range of cognitive disorders and cerebrovascular and cardiovascular diseases. Therefore, one of the preventive measures recommended to reduce the risk of dementia is to avoid excessive alcohol consumption. A maximum daily intake of 3 drinks for men and 2 drinks for women should be taken, and preferably that consumption is occasional. Eliminate smoking. Smoking is known to increase cardiovascular risk and cause narrowing of the arteries throughout the body's circulation and in the brain, directly affecting cognitive function and predisposing to dementia. Scientific studies have been able to demonstrate that quitting smoking reduces the risk of dementia in both men and women. Treat depression. A clear relationship between chronic depression and the risk of dementia in the medium and long term has been established, and this relationship is independent of the consumption of antidepressant medications like the ones we mentioned previously. This risk also occurs when consuming other types of antidepressants that are not linked to a higher risk of dementia or even with other therapeutic alternatives. The mechanism by which chronic depression can trigger dementia in the long term is unclear, but it is known that timely treatment of depression can significantly reduce the risk of dementia in the short term. As you can see, dementia is a public health problem that is increasing globally due to the increase in life expectancy of the population. For this reason, numerous investigations have been carried out, and certain risk factors have been established on which we can influence to decrease the possibility of dementia in the future. But it's very important to know that there are also medications that are frequently used in everyday life that can inadvertently increase your risk of dementia. If you're taking any of the medications we've mentioned in this video, talk to your doctor about the possibility of changing them, especially if you have hereditary factors associated with dementia, or consider the lifestyle changes that are important to make to stay mentally healthy.